So I'm James Morris, the director of the CSBR, the Policy Center dedicated to cyber security and resilience. And earlier this year, we kicked off some work around AI and healthcare. And 2 weeks ago, we published a paper about how to break down barriers to innovation in the NHS to realize the transformative potential of AI. And that paper contained a series of recommendations about how to deploy AI in various different settings to improve productivity. And I worked very closely on that paper in collaboration with Erik Schwartz.
Wonderful. Thanks, James, for taking some time today to have a conversation. I'm really excited to talk about the research that we did in light of this new report that's come out from the NHS. My name is Erik Schwartz. I am a co-founder of Elysia.ai Labs, and most recently I've been focused on my brand, which is the theAiExpert.ai. So if you're looking to integrate AI into your business and want to know how to get started, please visit me at theAiExpert.ai.
Fantastic. So today, Eric, the government published, as you alluded to, they've just published their long-awaited 10-year plan for the NHS, which is pretty ambitious. So, they recently announced that 29 billion pounds of extra money is going to go into the NHS over the next 3 years. They're looking to improve productivity, looking to move the system from one being about predominantly acute care to preventative care. And literally, the document's been published about an hour ago, so we've only just had a chance to have a look in it. But there's a lot in there about the potential of AI to transform healthcare and to improve the efficiency of the health service, deliver better patient care, and so on. And it also is a document that does recognise that the NHS hasn't been particularly brilliant at innovation in the past. So it's a pretty ambitious set of plans, which envisages a very transformed NHS in the UK with AI playing a critical role. So what's your kind of initial take, do you think, around some of the things which we were recommending in the paper and some of the blockages that need to be overcome to make this kind of dream a reality?
So it definitely hot off the press, and we're definitely just digesting this as it's come in and trying to get our heads around what it is. But it was really nice to see that in this paper, there's a lot of synergies with recommendations that we've made a few weeks ago. The plan, the plan starts out with five big bets, and the cornerstone of those five big bets, in addition to data and AI, include other things like genomics and wearables and robotics. But it's nice to see that data and AI become the cornerstone of the big bets in technology that they want to take. It was really also interesting to see that they really envision an incremental approach towards, even though it's an ambitious 10-year program, they really envision an incremental approach to adopting this inside of the NHS.
Yeah, I mean, and as you know, as we discussed a lot, um, the scale of the challenge and how you can embed these technologies better into the system. So, we talked about one of the recommendations around getting GPs to use AI for appointment setting, and in the government document they talk about using AI scribes and so on in order to kind of improve that front end efficiency.
That's right.
But how do we think? What kind of level of complexity is there in terms of making that happen? Because that's one of the sort of short-term wins that we identified in our paper.
Yeah, that's absolutely right. And, just stepping back a second from where those short-term goals were, they've set a really ambitious goal of having every hospital fully AI enabled within 10 years. Now, I
Yeah.
know AI is moving at an incredible pace, but 10 years is not a lot of time, especially given the history, right? And given how quickly how long it takes to evolve. But it's really nice to see some of those things highlighted. Some of those quick wins are very synergistic with our paper. The
Yeah.
notion of being able to free up time for doctors to be able to spend time with their patients versus having to spend a lot of time writing. I think that's been a clear recognition, that a lot of their time goes into summarization and writing and note taking. And if that can be automated in a way, that can give the doctors a lot more time to see more patients, to focus on the care that needs to be delivered.
But the one of the issues that came into my mind was about public confidence, which is a lot of people, the idea of the NHS and primary care was that, you can ring up, get an appointment, and go and see a doctor, and that people are still quite suspicious of technology and whatever. So there's a job of work there around building that public trust and confidence in the applications, and that they can be trusted, and that they're going to lead to better patient outcomes. And that's also, I think that's part of the kind of overall workforce challenge, which is getting people working within the NHS, whether that's doctors, nurses, ancillary staff, whoever it might be, getting them confident about using these AI tools, and to adopt them as being a kind of central thing in their professional lives.
Yeah, and as you know, with any workforce, there will be a part of the workforce that'll readily adopt these tools. They'll take them on and they'll embrace them and they'll use them every day. And there'll be another part of the workforce that says, I've been doing this for years. I know how to do my practice. I know how to do my trade. I don't need a new set of tools. I don't need to learn something new. I've already got
Yeah,
enough on my plate. And so, there's a change management program that has to happen. The approach that they're going to take is, and I think there's a lot of citizenship empowerment that's going to happen.
yeah,
One of the things that was announced a couple of weeks ago is a doubling down of AI into the NHS app. So that
yeah.
creates
Mm.
an informed citizenship. So patients can go into their GPs and to their appointments, having done a bit of research, having some background information, so that they aren't starting they can start at level playing fields when they go in. And I really love that. And this has been one of my observations. Having, I'm an American, as an
Yeah,
expat coming into
absolutely.
the UK and participating in the system. I think one of the clear observations that I made is that the system is very reactive, right? When you go and ask for an appointment, most GPs will say, "Well, what's wrong with you?" And in America, we were very used to sort of that annual wellness check, right? That proactive, preventative care, where you went in and you got your bloods done, you got your levels taken, your sugars, any number of sort of tests that were done on an annual basis. It's very
Yeah,
foreign to the general practice. And I think moving that lever into that domain, and they're starting, right, is they're going to start with pregnant women, which is a fantastic demographic, a fantastic group to start to be proactive with, because we know that just having information and keeping them informed addresses the
yeah.
vast majority of issues that happen during pregnancy.
Yeah, absolutely. And, so some of these, in our paper, we sort of divided the world into kind of a sort of short, medium, and longer term perspectives. And, some of these AI tools that we've been talking about in relation to improving admin and whatever. But then there's a kind of the more medium term, long term thing, because again, there's a big play about the importance of data and data sharing and the consolidation of data to improve patient care, and how that interrelates with the NHS app with an AI overlay, so that you can start to understand things at a more granular level. But as we know, one of the challenges is that the data sets within the NHS are not of the highest quality. And some of our medium-term recommendations are about trying to create knowledge platforms, and trying to create mechanisms for consolidating all of this important stuff, so that we can really start AI motoring on other things, not just on kind of improving day-to-day admin and relieving bureaucracy.
Cleaning data is such a huge part of having good AI and good automation. But the AI can be used for really doing that enrichment and that cleansing. It just comes from years of not having good data practices, not having good data hygiene, that it gets messy. But you're right, it's a really important thing to call out, because they talk about some new innovations, but they don't really specifically address, or how are we going to close this data gap? How are we going to deal
Yeah.
with different data sets that live
Mm.
at the national level, at the local level? How are we going to ensure that we maintain sovereignty over our data, and that we have
Yeah.
we have good, clean data, and that we're, that the the citizenship is informed. So I think it's still a gap, and I think
Yeah,
that could be a significant retardant on their ability to succeed their ambitious plans if they're not taking
yeah,
a strategic data first approach.
yeah. Because as we'll know, as you know, as we know, the the sort of I mean, the plan also envisages some quite big structural changes to the way the NHS has been operating. I think they're trying to move it to a much more integrated health and care system. This removal of NHS England, which was the executive body commissioning and managing the NHS, is removed. They're talking a lot about devolving the NHS to kind of neighborhood centres, so less emphasis on acute care and trying to shift the system to this kind of neighborhood prevention, so that there's, as well as the application of technology and AI, that needs to go in hand with a proper integration because, the care, adult social care and the care area is also one which is ripe for the quite a lot of different moving parts there.
Yeah, no, yeah, absolutely. I think, they have to take a prioritized approach. So they
Hmm.
mentioned specifically that they're going to try some of these tools in denser areas, for example, or areas
Yeah,
with denser
yeah,
population. The other thing that they came up with, which is really aligned with some of our recommendations, we had proposed a sandbox
yeah,
way of performing regulatory approvals, which means that you can test things out in a very contained way with high regulatory oversight. And what they propose, which almost is very aligned with that concept, is they want to create some regional health innovation zones, which will give some flexibility to learn what's working and what's not working, which helps them be a bit more agile as they adopt their plans. I imagine
yeah,
that they'll learn something and they'll come back and they'll probably refine it in 2 to 3 years based on how these two or three trailblazer regions work, and how the technology is adopted and how things
yeah.
actually behave.
I mean, I haven't, as I say, I haven't had chance to sort of dive right into the depths of the document, but they're also talking about, setting up a new way of the NHS procuring AI. And so maybe they're thinking there about, there's certain things that lend itself to more kind of centralized procurement rather than devolved procurement and different ways of, because historically the NHS, and again, I think the document acknowledges it in parts, has been quite bad at engaging with third party providers. And it's been a very transactional kind of procurement relationship, not one where it's collaborative and we're all working to try and get innovation and get new ideas working within the health system. So
Yeah,
there's
that's
quite a
right.
big job there to change the kind of procurement structure and the way that third party companies, small, medium-sized companies who might have a great idea, historically have found it very difficult to engage with the bureaucratic process of the NHS.
And if you think about the reason for those rules, I mean, those rules are there to mitigate risks, right? So
Yeah, yeah, absolutely.
there's a couple of things that they've highlighted that they want to improve in terms of time. They want to do faster clinical trials, so they want to reduce the time for clinical trials. They want to streamline procurement, and they want to make it easier for innovative ideas and incentives to come into the system.
Yeah.
But they have to, and I think running them through these innovation centers probably makes the
Mhm.
most sense, so they can actually
Yeah.
validate if they're working while containing, the potential risks to the whole population. So
Yeah,
there's
absolutely.
going to be some give and take, I think, as they start to accelerate here.
Because I think one of our long-term recommendations was precisely around this kind of health and social care integration framework that we've been talking about.
That's right.
I mean, one of I think recommendation 9 in our paper said support frameworks that deploy AI to bridge health and social care systems, including remote monitoring technologies and so on. And that chimes very much with the director of travel. I mean, health and social care integration has been spoken about a lot over the last couple of decades. But again, as our recommendation suggests, AI can act as a bridge to, start making that integration a reality.
That's right. Yeah, I think social care is a really important one, and it's not something I think it's a real highlight in our recommendation that isn't clearly documented in any of these papers. If you think about like the social care and some of the solutions that you can put in place with AI, we run into psychological situations where maybe someone's recovering from trauma or from some sort of accident that may have happened, and they don't feel safe or comfortable talking to a human or talking to an adult or talking to a male or a female, right? Because of the type of trauma they may have experienced. But when there's an AI there, they suddenly open up and they can, the AI can be probing and empathetic,
Yeah,
and it can start to be a real coach or a real psychological aid and allowing people just to open up or given that channel. So I think it's a really important thing that it could probably be added to the NHS app if that's adopted, but it's not something that's specifically called out as a as an objective that I've seen
yeah,
in the
yeah.
paper. And the initial in the last hour, and the initial
Well,
glance.
no, exactly. Yeah, there's a lot. It's 150 pages
When you get through
of
all of it.
document. Yeah, yeah, exactly, exactly. And
The other big one too, I think, going back to one of the points I raised earlier, I think one of the low-hanging fruit that we've identified as well is just notion around AI literacy, right?
yeah, yeah,
And so how do we get people familiar? This goes back to how do the citizens adopting it, the GPs adopting it, the doctors adopting it. People
yeah,
have to understand what it can and cannot do. And if there's not real education, there's going to be a lot of fear and uncertainty and doubt about, oh wow, if they've got an AI in my app and it's tracking my every move, and
yeah, yeah, yeah,
it's trying to deport me, or it's trying to it's trying to there people will jump to the worst possible conclusions when they think they're being monitored or watched. And so I think the real transparency around what these tools do and don't do and what their boundaries are is super important for success in an overall
yeah,
program like this.
yeah, yeah, and sort of demonstrating success in certain areas. And it's got implications. The overall thing about implications for the kind of workforce development within the NHS. I mean, the previous government put together a workforce plan, a 15-year workforce plan, and this new plan also talks about workforce development. And the NHS employs a lot of people currently, and there's a real need for some upskilling across the board, actually, in the people who work in the NHS, in order to be able to maximize the deployment of AI and embrace technology. Because as you will know, that there is still a huge amount of variability in the use of sometimes quite basic technology in the NHS. And the government's again envisaging a new, £10 billion for digital transformation, because the actual foundational bedrock of kind of IT infrastructure in the NHS is still a little bit not quite fit for purpose. So there's quite a lot of work there foundationally to get all of these building blocks in place.
And as you know, with any technology deployment, not only do they have to have the right staff and the right training and the right infrastructure
Yeah,
to run this behind the scenes, whether it's leveraging some of the foundation models in a secure sandbox, through some of the big
yeah,
cloud providers, but at the same time, it also has to be seamless and easy, right? They have to sort of take that Apple device approach so that it just works, right? If there's any friction, if it causes more problems, if data gets lost or there's leakages or it slows things down, people will lose patience right away, especially if there's an emergency or there's a life or death sort of situation where someone needs immediate hospital care or need an ambulance or it needs to react to maybe a stabbing or some sort of violent attack. You can't sit there and say, well, let's have a chat about, you can't have an AI there
yeah,
and say,
quite right. Yeah, yeah,
tell me how you feel about that, right? So
yeah,
it's got to be
yeah,
balanced.
yeah,
It's got to have the right triggers.
yeah, yeah. So, I mean, I think you're right when you say, I mean, 10 years is not that long a time
It's not.
in
It's
terms
really
of
not.
making transformation happen. And, I think the critical challenge is about, again, this 10-year plan does envisage, I mean, NHS England being abolished, some of the structural changes, they're again they're quite big shake-ups of the entire system.
Yeah.
And there's been a lot of shake-ups of the NHS system, which people have often said, are kind of too many shake-ups, too much reform, has led to a kind of reform fatigue, if you like. But with the NHS taking up 250 billion pounds of government expenditure by the end of the decade, it seems like, this is a critical juncture where the system's either going to decide that it's going to use and embrace the new technologies to change the system, or it's going to really struggle. Um, that's my sense.
Well, I think it's super important, and we need to continue to reinforce this as we drive policy and we think about leaders and change, that we really have to take an incremental approach. 10
Mm.
years, this big bang idea of every hospital will be fully AI enabled in 10 years, just to reiterate that point, it just seems like
Yeah,
a massive leap. And so, what are the
yeah,
steps that need to be taken to get from no AI enablement to partial AI enablement to some AI to we're really engaging in AI to fully AI. That's fine
yeah,
with steps, and to do those every 2 years would be aggressive for most hospitals while they continue to offer the same level of care,
yeah,
and safety that they need to. So I think it just we need to break it down. We need to
yeah,
figure out what that transition plan looks like, and then make sure that it's moving at the right pace. Throwing a lot of money, or bagging a big stick isn't always the best way to drive change management.
yeah,
Sometimes
yeah,
you need to take that startup approach of trying to make things lean, and
yeah.
efficient versus just throwing a lot of money at it, because then people get lazy when, oh, we've got lots of money and we don't have to think about it, right?
Well, I mean, and the context of this whole conversation about AI and transformation, as we said, is set in the context that 250 billion pounds accounts for, it will account to up to 40% of all government expenditure. So the NHS in England is on a pretty unsustainable trajectory, given the growth in spending on the NHS, and so therefore we're at this juncture because productivity needs to improve, demand needs to be better managed, and moving towards this preventative system, and we need to drive better outcomes. So that's where we've got to, I think.
Well, I think I read something in the paper, and I'm not sure if this is correct or not. So we'll keep me honest here. But I think one of their strategies, though, is to really try to regionalize this as much as possible. So one of the things I think that they want to do is they want to push as much power, or push as much authority
Yeah,
into regional surgeries, right? So that you can do a lot more at the surgery versus the overloaded hospitals. And I
yeah,
think
exactly.
trying to distribute the load a bit better, may help. And now I don't know if that's going to be okay, because
Well,
I know that most of these GPs and surgeries are completely overloaded and understaffed as it is. But this distribution of effort seems
absolutely.
to be the
I mean,
right approach.
I think it is. I mean, we're getting it's a slightly tangential point, but the establishment of what are calling integrated care boards, which have been in place, they were introduced by the previous government. Integrated care boards. The function of them was to kind of integrate health and care at a regional level. So there's quite a few of these ICBs, and I think they envisage that they're still going to be the kind of the kind of critical platform for regional commissioning and so on. I mean, I've been involved in policy making and politics in this area for quite a long time. And what tends to happen with thinking about NHS policy is it goes from thinking about centralizing everything to regionalizing everything, and it's kind of it goes between two poles. And actually, what we really need now is a period where some of those regional structures which are embedded need time to mature, and there needs to be this kind of injection of entrepreneurial energy into making change happen on the ground. But I think one of the big challenges, that's why I was referring to workforce, is that this the thing about the NHS, is that it's a quite politicized organization. So in the sense that there are a lot of workforce unions not really wanting to labor that point, but the that whole kind of workforce adoption of new skills, multidisciplinary teams, different skill sets, which might not be the same as the traditional skill sets, I think is quite a big and ambitious undertaking, because it envisages nursing and some clinicians and changing some of the ways in which they work. And historically, the NHS has not been good at sort of embracing that kind of level of change.
Yeah, no, exactly, James. I'm glad you brought that point up, because it was that level of change that I was alluding to, right? With that
Yeah,
change,
yeah,
so how do we create at the regional level more authority, or shift that into different roles, whether it's the nursing staff or or administrative staff that can help support the load, right? That's
yeah,
what, the other thing that is announced is the NICE organization, the NICE group within the
yeah.
NHS will also have a much more authority to assess innovations and technologies, but also be able to decommission things that aren't working. So that'll
Sure.
help centralize some of the technology innovations, and it won't be as random or distributed, and things that just aren't working, they can move out of the system
Yeah,
faster, right?
yeah, yeah. Well, I think have we've gone over quite a few bits and pieces there, Eric, just sort of reacting to the plan that's just been put in front of us, and I'm sure we'll come back to getting into this in a bit more detail. But I would encourage people to read the paper we published a couple of weeks ago, because it's a kind of not oversimplified, but it is a simplification of 10 points and recommendations, quite a lot of which have appeared in this NHS plan, but some of the big challenges around trying to innovate and get it to work still exist. So maybe we'll go away and read this document in a bit more detail, Eric, and we can come back and have a second round.
Yeah, no, that sounds great. I mean, I think there's some couple of highlights just to kind of wrap up. This notion of patients having a doctor in their pocket through the NHS app is kind of is really it's innovative, right?
Mm,
That they can have, and health tech has been trying to do that for quite a few years, right? Just have this app, something I can talk to. Um, we talked about clinical trials being reduced. There's some productivity targets, so they want to increase productivity by 2%. And they want to do some more adoption and screening, a little bit more
mm.
proactive care, which I think is great. So,
Yeah, great. Well, thanks for your time, Eric, and I'm sure we will get together again and we'll continue this important discussion.
James, it was a fantastic conversation. Thanks so much for taking some time to react to the new document, and I look forward to talking to you again soon.
Fantastic.